So what we're going to be working on today is scar cupping. Now, the scar is right through here. And the scar has some age to it. But when this area is cut right here, so this is where the incisions, staples would have been. That was the initial place of entry. But when they go in and pull that apart so that they can get to the spine. Well, what it does on a subsurface level is it creates tearing all down through here. So when they pull this open, it begins to tear all through here. Does that make any sense to you? And so basically you end up with not just a scar here, but you end up with adhesion here. Now, one of the things that we're going to look at, because in this particular instance, she has pain that travels up into the shoulder blades. You can probably hear her expressing her dislike for the sensitivity here. So there is a trigger point there in Levata scapula, and that came across from that adhesion right here. This one actually goes up into the neck, into the base of the skull. We're going to be looking for another adhesion because she has low back pain and shoulder pain and rib pain. So literally all through the medial border of the scapula, she has injuries. There's another one right here. There's another one right here. And you hear her strong vocal expressions. I'm barely touching her. And that comes right so you could actually see how this injury here came right over into here. So this will give us our framework. This is muscle mapping. And so with one more cup, we're going to begin to go through and release these injuries. What I'm going to do first is put some topical lotion through here just to kind of soften the skin a little bit. You doing okay? We're going to use magnetic cups for this. One of the first things I'm going to do is tack down S1 and L5. I'm going to come all the way up to C7 and T1. We're going to go right under T2 and T3. 4 and 5, 6 and 7, there's 8, now the thing that I've done is I've left the scar open. We've not cupped it yet. What I'm going to do is come over here and we're going to cup over in this large injury pattern here. This may be kind of tender for you. Please give me guidance. Is that acceptable? you've had back pain for quite a long time, haven't you?
Yes.
And not just casual like tension. I mean, it's actually raw
Yeah,
pain.
it's pretty debilitating when it's really flared up.
Okay. Now we're going to go back up and we're going to catch right through here. This is going to be the attachment site on the superior midline of levator scapula. And we're going to come up levator scapula. We're not going to go all the way into the skull, but we're going to catch all the way up across splenius capitis. There we go. Very good. Now this connection that comes down the rib, down the inside medial border of the scapula. But before we put cups here, I'm going to release the scapula. That's the shoulder blade. So I'm going to lift that away from the rib cage. We're going to begin to cup this inside line. This is going to begin to release pain, tension, agitation, discomfort. Very good. Now the thing that I'm noticing right through here is really tight. Can you feel that?
Yes.
Now what we're going to do, I'm going to remove a few of these marks because I want to help you understand something really significant here. Part of the problem that we have is, so we've got spine right here, and you've got the quadratus labortum, so you've got rib 12 right here. You've got the hip crest right here. And then we have a muscle that's attached there and attached there. This muscle is the QL. Okay? And this muscle has fibers that run all the way through here. So basically, whenever she lifts up her hip or hikes up her hip, this muscle contracts and squeezes, and that's what allows her to either bend her shoulder over to pick up something or to hike up her hip. All this right here is extremely tight. And so we've got ribs coming through here. And so we want to release all of that. A little bit of topical lotion. Now what we're going to do is go ahead, we're going to drop right down into ribs 11 and 12. I'm going to come back across rib 12. Are you okay? I'm coming all the way into the scar now. But because I want to pull this injury, because it could come out the other side, we don't know yet, I'm going to go ahead and assume that this tension pulls all the way across. So we're going to release this injury through the right hand side of the body as well. Sometimes injuries will stop on the midline, and other times they keep going. Are you okay? So today we're dealing with shoulder pain, rib pain, and low back pain. What I'm going to do, I'm going to take some of these cups off, and I'm going to transition them to the QL.
I'm actually getting some referred pain down in my hamstring.
Okay, so when we put this cup on right here, she started getting a referral pattern to her hamstring,
The lateral part of the leg.
more the lateral.
Yeah, that's it.
Okay, so what we've just learned through her helping, we just learned that we have found another injury pattern. So what we're gonna do, it was when I put this cup on here, and I can feel the band right through here. So let me explain what has happened here. This cup has an adhesion, and that adhesion travels all the way down to what would be the knee. So very possibly at some point in time, this particular client would have some pain or discomfort that would travel into the knee because this tension is pulling all the way up here. So what we're gonna do is go ahead and finish releasing QL. Gonna release the shoulder. How are you holding up? As we're explaining this to you, as you're hearing this, is it making sense to you?
Yes.
Okay, so we're gonna remove, I'm gonna leave these on the left rib that are injured. I'm gonna go ahead and catch this injury pattern that trails down through here. I'm gonna grab it at the knee first. I'm gonna work my way back up. Please communicate with me as each cup goes on.
Okay.
One more cup. We're gonna give you a break here for just a moment. Now I can actually feel that adhesion. An adhesion is almost like a band or a cord. You can move around.
I should move my arm. That's better.
Okay. And you can probably see part of this band that's coming up. This could be the last part that we're going to release. We've got another cup here. Okay. We're going to let these cups sit for just a moment. How are you holding up? Very good. Go ahead and release. Just flush some of this out here. Anytime that we do cupping, we also want to flush and release because we're draining into the lymphatic system. All of these marks are cupping marks, they're not bruises. This is where toxins are leaving the tissue. Very good. How are you holding up?
Good.
Okay, we're gonna release the spine. Flush right through the spine. How you doing?
That's really fine. That scar's so tender.
Mm-hmm.
Most of my scar is really tender.
Were you aware that it was tender before today?
Oh, not really, no.
Okay. Those of you watching, one of the reasons you want to cup scars is because oftentimes they'll be the source of the injury. Okay, we're going to release a few more cups here. Very good. So one of the things now that we're seeing, and we're seeing this because of all the other cups being removed, that basically part of the injury in her shoulder and the rib cage was not just because of the injuries that were traveling here, but there were also injuries that were traveling through here. So literally this tension had attached itself to the knee and was pulling all the way up through the hip and grabbing hold of the rib cage. Deep breath in through the nose and exhale. Slowly removing cups. Two more cups left to remove. We'll have you free from this pressure. Deep breath in. Very good. Okay. Back up. And this is how we use cupping therapy to release scar tissue. It's how we use muscle mapping to see how these areas are connected together. That way we can help the whole body heal.